So not too long ago, we talked about big picture, little picture when it came time to thinking about environmental health, tissue health, movement quality, adaptation. So specifically, we can't parse out your sleep, we can't parse out your nutrition, your stress. Do you feel loved in your environment? Do you feel stoked? All of those things are hugely, hugely important to have the human being just be more tolerant, more sort of robust. But the little picture window means that, hey, I do have to still care about what's going on at a localized tissue spot, what's going on in the area that I'm caring about. So what I want to do today is talk about some of the ways that here I am post-surgical 10 days out from a total knee replacement, and what are some of the things that I can do to really work on that little picture idea. So one of the things that we're keen on is trying to get just input into the system. So imagine you have all of this rich sensory motor input going on all the time. You're moving, you're loading, you're exploring, you're playing, and all of a sudden that connection is cut either surgically because we just had big surgical trauma. My brain isn't getting even some of the same inputs it did just because of the nature of what happened in the surgery. But secondarily, look at how rich the environment is for my knee right now. It's actually pretty poor. Right? I'm kind of trying to manage my swelling, appropriately dose the tissues, and then chill. Manage my swelling, appropriately dose the tissues, and then see if I can get ahead again of that adaptation response. So one of the things that I'm trying to do is just get some more input into the system, have some feels, right? Have my brain know where it is. And there's a couple things that you can do really dramatically that make a big difference. One is that I've got this little towel here, and I do this usually when I hop out of the shower, but if you just take a towel, not even in your own hand, your hands can be great, is that we actually see that people don't actually touch their limb or their surgical site. Somehow we've told people, hey, stay away from this, you're gonna infect it, you're gonna mess with it. But look, I've got Tegaderm on here, I'm covered, and I don't even have to mess with my surgical site, but I want you to get into the habit of teaching people that they need to be responsible for owning that. And if that could be lotion, that's great, but just putting input into the system can help that your brain is getting other information from the tissues, not just interpreting the only signal as pain, right? That's one of those gate mechanisms, that there's a lot of sensory information coming from the limb, from the tissues, from the skin, from the joint. But if I'm not doing that or loading it or touching it or anything, my brain only gets one signal, which is, hey, I don't know what's going on there, but let's interpret that as threat and pain. And a simple way, again, is to take just a simple soft towel and to rub that, and it will feel good. You'll be like, oh, it's like the deepest itch of all time. Fantastic, that's the game. One of the things that works really well is that, remember, I have a congested tissue here, and I'm getting pretty close, right? I've been able to keep my quad mass, which is a pretty big deal, because I'm pumping and keeping this leg connected. I don't have my terminal knee extension because of the swelling, but one of the things that happens is you can see, even though I've been on the Normatec, I've been on the elevation, I'm doing my best I can to get these tissues warm and then pump out, I'm still a little bit behind on the swelling. So let me show you what I'm talking about. I'm gonna push hard on my shin here, and I've got a little pitting edema, which means that I've left a little bit of, I have some interstitial fluids caught in those layers. And one of the things that happens is that suddenly I have tissues that don't slide and glide. So if I look at my other limb, my reference limb, notice that the tissue slides easily here. I do this, and guess what? I got SFA, not much, right? So what I'm trying to do here is appreciate that, again, even though this isn't directly in my surgical site, man, I have a tissue sliding problem here. And one of the ways that we can manage that, for example, is to even throw in a little VooDoo floss around this tissue I'm trying to change. And notice, I am not going very tight here. I'm just trying to get kind of some gription into these tissues. And then one of the things that I can do, and again, this is so easy, is just I'm just getting these tissues to slide. So just rotating one direction, rotating the other direction, pushing and pulling. What I'm doing when I VooDoo floss that is I'm trapping that whole circumferential fascial sheath. I'm making it a unit and forcing the whole thing to work. Instead of just one finger, I'm really looking at what's happening in this direction. I can push and pull, I can push the tissues down, push and pull. And the goal here is just to get some input in, but also I'm restoring some of my sliding surfaces. So very, very simple idea. Again, not even tight, just enough to get a little bit of a gription. And then when I pop that off, what of course we should see is, hey, I'm doing better. Those tissues are sliding a little bit more. Oh, that is better. Look at that. Just quickly by grabbing that, I'm getting some better sliding, which is going to make it easier for me to remove that congestion. I can't have tissues that are just locked down. The concrete fluid doesn't flow very easily through there. So I'm just trying to improve the pump system or the pump housing so that the pump can do its job. Up top here, this is one of my favorite uses of gua sha, right? And this is just a little, this is by our friends at Field Foam. And what's great about the Field Foam is it's not greasy, it's antibacterial. So anytime I put this on, I'm actually conditioning the skin and making the skin sterile, Field Foam. But what's nice here is that this is an easy way to come in and work on these tissues. And now notice, I'm not going after this like, yeah, break up scar tissue. I don't even know what that means. What I'm doing is coming in and trying to just get some input in here and a little bit of light surface motion so that I'm just getting these tissues to slide and glide a little bit. And what I think is powerful about being able to do this to yourself with a spatula or a butter knife, if you don't have a great scraping tool, this is the leopard claw. This is an easy way of, again, helping your brain think differently about what the tissues are saying, or in our language, we say desensitization. So a powerful way of desensitizing these tissues is just to put a little input. And if it feels like brutal and tender and bruised, go super light there. You can still stay on the surface, and on tissues that can handle a little more, give a little bit more. And the second it doesn't feel good, you're done. So the idea here is just to put a little input in here, which is going to improve blood flow locally, which is going to help my brain think differently about what's going on. Also, just gives me agency. And suddenly you can see that if I compare this side, look, it's like a Sharpie over here, right? That's what my skin should look like, even my IT band. Although here, all of a sudden, like great, I can pucker the skin up, but it is not the same as over here. So of course, these tissues are swollen, but my goal is to have tissues that slide and articulate. And I'm not saying that this is an hour a day, this is just once during the day. This may be a simple way to get some blood flow in, or just get the deepest itches into those tissues which haven't been touched, which haven't been loaded, which haven't been exposed to their normal ideas. So ideas here, input can come in a lot of different ways. It doesn't have to come in with just straight leg raises and quad sets, right, and heel slides. There is a lot you can do through touch, and do not overlook the power of putting your hands on your body. Do not forget that you are still a biological, mechanical system, a wet lever motor system attached to a very, very complex computing processing system, right? These things are integrated systems. But go from big picture back to little picture, and then what we see is the changes on both sides. Hopefully it gives you some more ideas.